Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Assalamu alaikum. Uh, Today's video is specifically for medical students who are learning eye ophthalmology. And in my previous video, in one of the videos, I discussed how to attempt the scenario based questions. And we discussed the glaucoma in that video. Today I have chosen a cataract. If a patient has got cataract, that is a specification of the lens which is called cataract. How examiners make the scenario, and what are the key points which you should be looking for to reach to the proper diagnosis. So cataract, a patient of cataract usually presents after the age of 60 or around about 70 years, but it is not the hard and fast rule. Cataract can be congenital, it can be juvenile, it can be at any age, it can be pre-senile, but usually it is after 60 65 plus, and senile cataract is the most common cause. So the scenario can be somewhat like this: a 70-year-old female presented or male presented in IOPD with gradual painless loss of vision for the last 1 year. On examination, vision in his right eye is 6 by 18, and in the left eye it is 6 by 60. And on further examination, it was the only positive finding which was detected was the pupil of the left eye was not black, and it was showing a little haziness. That's it. What is the probable diagnosis, and how will you manage this patient? Now, what is the key point? There are a couple of points in this scenario. Number one, age of the patient, 70 years. Every age group has got a specific disease usually, but it's not the hard and fast rule. Any disease can happen at any age usually, but first hint is the age. It's an old age or aged patient, around about 70 years. So it goes in favor of cataract. The second hint which is hidden in the scenario is bilateral gradual and painless loss of vision in both eyes. So it is a very big hint for a patient who is of in this age bracket. And the first, even only this hint is given, you should think about cataract at the top of the diagnosis. And a further very specifically, if this I have made this scenario easy for you, that on examination the pupil of the left eye was hazy or not black, So you know that normally the color of the pupil is black. In cataract, the pupil becomes white or hazy. If I would have said it is white, then the diagnosis becomes very obvious. So these are three hints. How will you proceed? We will we have two options. Number one, according to patient's social setup, his affordability and other things, we can go for conventional cataract surgery, that is extracapsular cataract extraction, in which we give an incision of 8 to 10 milligram 8 to 10 millimeters, sorry, and we take out the lens, and we implant the intraocular lens and apply or about 5 sutures, and after about 40 days the sutures are taken out, and usually the patient becomes 6 by 6 after the operation. The latest technique is phacoemulsification, which is now the procedure of choice for most of the patients, even the non-reporting patients. And in this, we give the incision of only 3.2 millimeter as compared to 8 to 10 millimeter of incision which we give in cataract. And from that incision, we insert the phaco probe and emulsify and eat away the cataract inside the eye, and put the artificial intraocular lens inside the eye, and there is no stitch, and the patient, after an uneventful phaco surgery, should see on Snellen chart at least 6 by 9 at the first post-operative day, maybe 6 by 6, and it is because there is no suture, there is no astigmatism. In extracapsular cataract extraction, we had 5 sutures, and the astigmatism was induced, and some other things were also there. So it is the management. Now I would just change the age of the patient, and just to see that how the scenario uh, changes its shape and how the diagnosis changes. Let's say one thing, the cataract is in the left eye more than the right, because I told you in the scenario that the vision in the right eye is 6 by 18, that is it is better than the left eye in which the vision was 6 by 16. So in left eye the cataract was mature, that is all the layers of the lens were opacified, and in the right eye the cataract was immature, that is all the three layers of the lens were not opacified. So we will go for surgery for left eye first. Now for example, if the scenario is same and the age of the patient is 25 of any gender, now you should not think about cataract at this age, though the cataract can happen at any age, but you should not think about this at the top of the list. The top of the list at this age is refractive error. So you will go for auto-refraction or retinoscopy, and there is a high probability that you will find some refractive error, and the patient will become uh, curable by wearing the glasses only. Now, for example, if the patient is a 3-year-old boy or girl in the same scenario, and the pupil in the one eye is hazy or white, less than 3 years, say 2 years old, and the parents have brought the child, then it can be cataract, it can be congenital cataract, but most ophthalmologists are afraid of retinoblastoma, which is the most common intraocular malignancy in children under the age of 2 years. The mean age of presentation of retinoblastoma is 18 months. So we have to rule out this intraocular malignancy, and if it is there, then the treatment will be different. We may have to take out the eye, unfortunately, to save the life of the patient. If it is cataract, then the treatment is simple. We will simply aspirate or remove the lens, and we will implant the intraocular lens. So you see, in the same scenario, just by changing the age, the diagnosis and management becomes totally different. So I hope this video would be of some help for you to make a conceptual image, a conceptual knowledge of ophthalmology, not only to attempt the paper, but also for your knowledge of the eye as you are becoming doctor, inshallah. And in the end, please, in the comment box, write down your questions, your comments. If you like this video, if you dislike this video, or whatever you want to watch and listen, so that I may talk on that topic and we can discuss these together. Here in the God's will, hope to see you soon with some next surprising video. Stay tuned, and till now uh, I'm saying goodbye to you. Allah Hafiz. Thank you very much.